Today I want to share with you a simple knowledge of what is hydrocephalus, and so I want you to get just a simple knowledge to understand just a picture of what happens for someone to get hydrocephalus. Hydrocephalus refers to accumulation of cerebrospinal fluid within the brain ventricles. So, for hydrocephalus to occur, there should be an accumulation of cerebrospinal fluid within the brain ventricles. So, there are several causes which cause this cerebrospinal fluid to accumulate within the brain ventricles. And these causes, as shown here, possible cause of hydrocephalus. The first cause, it might be the overproduction of cerebrospinal fluid, where there is a large amount of cerebrospinal fluid produced within the brain ventricles, but there is a slow absorption compared to production. So, which cause the accumulation of cerebrospinal fluid. And also, the same cause which relate to overproduction, it can be the external cause where someone has got an head injury, so the blood is accumulating within the brain ventricles. But also, it can be an impaired absorption. This happens when the amount of cerebrospinal fluid is produced as a normal amount of cerebrospinal fluid, but due to an impaired absorption, so it leads to an accumulation of cerebrospinal fluid because it is produced but not absorbed. And another one is blockage. This blockage, it occurs on the flow system of cerebrospinal fluid, so which cause an obstacle for it to flow and get absorbed. So from this possible cause is where we get some different type of hydrocephalus. So from this cause, we get two types of hydrocephalus. From here, of overproduction and impaired absorption, these causes we get the type of communicating hydrocephalus, which means the communication between one ventricle and the other ventricle to the absorption space is free, but there is other causes with production or absorption. But also from blockage we get another type of hydrocephalus, which is called non-communicating hydrocephalus. So this is a hydrocephalus which results from an interrupted communication of flow of cerebrospinal fluid within the ventricles. So let us move here on a simple diagram to understand this cause. So as you can see here, we have the left ventricle, the right ventricle, the choroid plexus, the third ventricle, the cerebral aqueduct, the fourth ventricle, in the subarachnoid space. For the case of overproduction of cerebrospinal fluid, this occurs when the cerebrospinal fluid is produced in a large amount within these left and right ventricles through this choroid plexus. So the amount of cerebrospinal fluid is produced. So if there is a large amount produced compared to absorption, it affects the amount of cerebrospinal fluid. So it causes large amount to be accumulated than the amount which is absorbed. But another one, the amount of cerebrospinal fluid is produced in a normal value. So, but here in absorption place, which is called subarachnoid space, there is an impaired absorption. So this amount of fluid, although it is produced in a low amount, but there is no absorption, so automatically the amount of fluid will accumulate within the brain ventricle. And this is so-called communicating hydrocephalus, where these ventricles are free communicating, but there is other factors where there is overproduction or there is impaired absorption. And another type of non-communicating hydrocephalus, if there is a blockage here within the cerebral aqueduct, or there is a stenosis which causes the cerebrospinal fluid to freely flow until to reach the subarachnoid space for absorption, so which cause an accumulation of cerebrospinal fluid within the brain ventricles. And this accumulation, as you can see in newborn babies, where there is accumulation, as you can see, the skull or the cranium of the babies grows fast due to an increased intracranial pressure. So because these babies, their skull are not fused, the cranial sutures are still not fused. So if there is an increase of intracranial pressure due to accumulation of cerebrospinal fluid, so this force the skull of the baby to expand so that to accommodate the space within the cranium. But also in adult, when there is an accumulation of cerebrospinal fluid within these ventricles, so in adult, most of them, this is an acquired hydrocephalus, which results from where someone has got a tumor which compresses the flow of the cerebrospinal fluid, or someone has got an injury which causes bleeding here. But in adult, also it can occur due to an increased venous pressure, which causes the transudate fluid to increase within the brain ventricles. So there are different management of this condition, hydrocephalus. Some of them, as you can see here, we have diuretics. This is in the management of post-hemorrhagic hydrocephalus, which is common in a newborn. But also there is a shunting, where a tube is pressed within the brain ventricles, and it goes down there to the abdomen within the stomach for absorption. But also there is a surgery, which the procedure is so-called ventriculostomy. So this it is done to the obstructive or non-communicating hydrocephalus, which it might be due to cerebral aqueduct stenosis or a tumor which complies the flow of cerebrospinal fluid. But also when someone has got hydrocephalus, there might be some complication. Let us see some of them, which there is a visual changes due to an increase in intracranial pressures, and might damage some optical structures. The eye may be damaged due to an increased intracranial pressure, and some of people may present with chronic papilloedema due to an increase of intracranial pressure. But also someone may present with cognitive dysfunction, also gait changes, and sometimes it causes death. So by saying so, I think you have get a simple knowledge about what is hydrocephalus and some possible causes. Thank you.